The island's hospitals are still under pressure, with most COVID-19 wards still at full capacity. But Health and Wellness Minister Dr. Christopher Tufton says as more Jamaicans get vaccinated, he expects the number of hospitalizations to drop. He addressed the situation at a recent COVID-19 conversation press briefing. The Health and Wellness Minister, Dr. Christopher Tufton, says his ministry has been able to procure more COVID-19 vaccines, despite there being a shortage of supply, in some instances due to vaccine hoarding.
With the efforts of the NHF, Mr. Mitchell and his team, Everton Anderson, and the rest of us, we have been able to secure some vaccines starting as early as this weekend. And this is really good news, very, very good news for us.
Dr. Tufton says 75,000 doses of AstraZeneca COVID-19 vaccines were procured through the African Medical Support Platform, and they're en route to Jamaica.
And then we have another 20,000 doses of the Moderna, which we have sourced through some other commercial arrangements. I don't have the specific details on that, but very welcome. This Moderna, this will be the first Moderna branded that we would have gotten. And then we anticipate, based on information we've received from the COVAX facility, the WHO supported COVAX facility, a 26,000 dose of AstraZeneca, which hopefully will come to us sometime in the early April.
He says these should ensure the government's ability to continue to administer vaccines over the next 6 weeks. He says vaccination is an important part of the government's response to the COVID-19 pandemic.
We are hoping that we will see or realize these doses, this amount, in over the next, which will allow us to continue the program over the next, I would say, 4 to 6 weeks. And during that time, of course, we are aggressively pursuing other sources, and we have expectations to be supplied through the contracts or the agreements that we already have, in particular COVAX and also the African Medical Support Platform.
Minister Tufton says he expects the market for vaccines to free up a bit in a few months as countries slow down on stockpiling their supply.